Ileana, 5 minutes or more on her own, and proceed.
Thank you very much, Mr. Chairman, ranking members, and members. As we have stated, Medicare fraud is a problem that hurts our most vulnerable citizens. An estimated $60 billion
Ileana, is your mic on?
That would help. Thank you.
Yeah.
Have in our government services. South Florida, unfortunately, the district that Ron and I represent, is known as the epicenter of Medicare fraud. Our constituents have felt firsthand the devastation and the hardship that it causes. The perpetrators of Medicare fraud have become more sophisticated and more nuanced in their schemes. No longer is it the uncoordinated or lone individuals engaging in this criminal practice. We're now seeing groups of individuals who are well organized in their techniques. Just last month, Miami native David Marrero was convicted of running a scam whereby he billed Medicare for expensive injection and infusion medications purportedly to treat HIV/AIDS-related blood disorders. In fact, no one had received this treatment. By the time the authorities had caught up with him, he had received $5.8 million in Medicare payments. This is simply unacceptable. Congress must stand united in saying in no uncertain terms that our seniors are not going to be preyed upon by opportunistic vandals. Ron Klein and I are working together for a solution to this intolerable problem. Our Medicare Fraud Enforcement and Prevention Act will provide badly needed reform to the Medicare system. This bill builds upon the tools that the Affordable Care Act gave CMS and HHS to fight fraud and abuse. I'd like to focus on two aspects of the bill which help illustrate the need to make the law catch up with the times in which we live. In many cases of fraud, the corporate officers who were complicit in the crime change companies and continue to engage in Medicare fraud. The crooks are not excluded, incredibly enough, from billing Medicare. The Office of the Inspector General, OIG, can only exclude corporate officials if they are presently involved with the entity committing fraud. This is unbelievable. We cannot allow these criminals to play musical chairs and go from one company to the other. Our bill would give OIG expanded authority to exclude individuals who were corporate officers or managing employees of entities at the time that the entities engaged in healthcare fraud. And the other part of the bill would create a pilot program that implements biometric technology to ensure that Medicare beneficiaries are physically present to receive these services. Many times the elderly are conned into giving up their Medicare ID to unscrupulous service providers. These providers that bill Medicare for services that are never rendered and equipment that is in fact never used. Just last week, Secretary Sebelius held a webcast about how to eliminate Medicare fraud. Examples of the fraud that she discussed were stolen Medicare numbers used to submit claims that are fraudulent, and stolen identities of providers used to submit claims that are also fraudulent. These are the types of cases where an implementation of biometric technology would be most useful. Using a biometric product to sign patients in at the provider's office would not only guarantee that the correct patient is present for services, but would also protect patients and providers from medical identity theft. In April, 6 Miami residents were charged in an elaborate fraud scheme. They had paid kickbacks to Medicare beneficiaries to have them sign logs stating that they had received the treatments that were billed to Medicare when in fact they had not received any of those services. This single case cost Medicare $13 million. Biometric technology would have prevented these phony claims from ever being reimbursed. If successful, this pilot program can be incorporated throughout the nation and will become a firewall against such abuse. In the past few years, there have been success in fighting fraud. Since its inception in 2007, Miami-Dade County's interagency Medicare strike force has helped fight fraud in our communities. It has gotten more than $220 million in court-ordered restitution to Medicare from defendants in 87 separate cases. The task force has saved Medicare approximately $1.75 billion in phony claim submissions, but there's still so much left to be done. Our bill would help give law enforcement the tools necessary to make even more arrests and track down fraud in a more efficient and effective manner. So I thank our good chairman and the ranking members and all the members for inviting us and holding this timely hearing. And with these kinds of bills, we will soon restore our seniors' peace of mind and trust in our Medicare system. I thank the members for the time.